Hi, I'm Dr. Veda, and it's very nice to meet you. So I hear you've had a bit of an accident today. Okay. Yeah, well, I am glad you came in if you think you have a concussion. Even if you think it's mild, it's better to be safe. So, what kind of symptoms are you experiencing? Do you have a headache? Okay, a little bit of a headache, alright. And any vision issues, blurriness, double vision? Okay, well, that's good at least. And any memory loss either before or after the event? Alright, so we can't remember exactly what happened right before. That's pretty typical. Okay. So that does sound like a possible or probable concussion, though you believe it's mild. I'm still glad you came in, and we'll get you a full and thorough checkup just to make sure that everything is okay. I am going to start by taking your vital signs, okay? Alright. Just get your temperature first. Yeah, even if really this doesn't have anything to do with it, I want to make sure that you're not sick in any other way that might impact the test. So, okay. Let's go ahead and under the tongue, please. Alright. We'll just wait a second for that. Okay, 98.6. So, no temperature. That's good. And just grab my stethoscope here. I am going to get your pulse next, so if you could just uncross your legs for me. Thank you. And I'm going to come to your left arm, okay? Just get on here. Yeah, it gets pretty tight. Get that on there. And let's see about your blood pressure. Okay. We'll let this air out. Very good. Okay. We have 120/80, so that is perfectly fine. Put that aside. And I'm going to get your blood oxygen level, so I just need your finger. Put this on. Just give that a moment. Now, how did this happen? Okay, yeah, you were playing soccer. Is it like intramural soccer? Yeah, okay. Have you had head injuries like this in the past? Okay, that's good, because they can be cumulative in terms of damage. I'm sure you've heard about recent issues with concussions in the NFL and the effects that they can have take a toll over time. So definitely want to make sure that this is not something that's happening to you on a regular basis. So that is good. All right, let me get that off. 99%. So that's great. All right. Now, you haven't seen any no blood or anything? Okay. Okay, so you do feel a bit of a bump. Yeah. Let's just get my gloves on here. And I will take a look. Where is it that you actually were hit? Okay, so right around the top, the crown of your head. Okay. Just just gonna come in and take a look, make sure that I don't see any visible signs of trauma. I know you feel a bump, so I'll probably be able to feel that a bit, but okay. And that's the only place you feel. Okay, so just up here. Oh yeah, I do feel that. I'm gonna be very gentle with it because I'm sure it's a bit tender. Yeah. Okay. Just be careful with that there. Yeah, I mean, it didn't puncture or anything, so there's no blood, but in terms of head trauma, that's not really a good or bad thing necessarily. I mean, it's probably always good to not have an open wound, but that doesn't mean it's not serious, you know. So, okay. That looks okay though. I don't need to treat that or anything in terms of a wound. Have you been icing at all? Okay, so you did ice a little bit on the way here. Okay, and you came right here after you had the injury. Okay, that's good. Alright. The next thing that I'm going to do, you seem very coherent. It's not like you're having a hard time answering my questions. So I am going to do a mini mental state examination. This will help me with some of your memory stuff, make sure that your mind is working correctly, because sometimes after a concussion you can be very confused, even not know where you are, what year it is, or have sort of perceptive or spatial issues. So this will make sure that you don't have any of that going on. So I'm just going to go through that first, and then we'll do a sort of mini cranial nerve exam to make sure that everything is functioning correctly there. So first of all, what year is it? Okay. Thank you. And the season? Yep. Do you know the date? Yeah. Okay. That's okay. That's close. Day of the week. Perfect. And the month. Okay. Good. Oh no. Honestly, I have to look at my watch or look at a calendar to know the day unless I've looked at it recently, so that's not anything to worry about. Or the date, not the day. Okay, do you know where you are right now? Yeah, and the name of the medical practice? Perfect. And what state are we in? Okay. The town? Perfect. And what floor are you on in this building? Okay, very good. Now, I am going to name 3 objects, and I want you to remember them and repeat them back to me, okay? And try to remember them because I will ask you again at the end what the 3 objects are, okay? The objects are floor, ball, and banana. Can you repeat those back to me? Very good. Okay. Now, this one's a little bit tricky, but I think you can do it. I want you to count backwards from 100 by 7s. So starting at 100, what would be the next number? So 100 minus 7. Good. And 93 minus 7. Good. And minus 7. Good. Minus 7. Good. And one more. Very good. Okay. So we stopped at 65. Can you spell world backwards? World. Very good. All right. Looking really good so far. Okay. So a few questions ago, I told you the name of 3 things. Can you repeat those back to me? Yep, floor, ball, banana. Good. Okay. can you tell me what this is? Yeah. And can you tell me what this is? Excellent. Okay. And I'm going to say a phrase, and I'd like you to repeat it back to me. No ifs, ands, or buts. Perfect. Now, I'm going to show you something. I'd like you to read it and do what it says. You don't have to read it out loud. Just read it to yourself and do what it says, okay? Good. All right. And the last thing I'm going to have you do, I am going to show you some objects on a page, and I'd like you to copy the drawing as best you can, okay? So I'm going to give you the pen and the clipboard, and I'd like you to copy this right down below as best you can, okay? All right. Here you go. Now, I totally understand with a ruler it would be easier. Okay. Yep. Good. All right. Great job. Okay. So the mini mental state exam you passed with flying colors. So it seems like your mental state has not been affected, which is very good. Now I'm just going to do a brief cranial nerve exam just to make sure that nothing is physically affected as well, okay? So I want you first of all to look right at me, right at my nose, and let me know when you see my fingers coming into your peripheral vision, okay? Look right at my nose. Good. Again, look right at my nose. Very good. Now I'm going to bring them in. Let me know when you see them. Good. Which one moved? Good. Which one moved? Good. And again. Which one moved? Very good. Okay. I have a little mini eye chart here, and I need you to read the letters here. Good. 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 Now I'm going to cover your right eye. Okay. Can you read the next line that we haven't read yet? Very good. Now I'm going to cover your left eye. And can you read that line backwards, the one that you just read? Very good. Okay, can you read this letter? This one. This one. This one. And this one. Good. And the last line, can you read this letter? Good. This letter. Good. This letter. Good. And the last one. Very good. Can you read the last line again? Just this eye. Excellent. And the last line backwards, just this eye. Very good. What color and shape is this? Perfect. And what color and shape is this? Excellent. Okay. Alright. I am going to shine a light in your eyes. I know you have a bit of a headache, so this won't take too long, and hopefully you're not super light sensitive, okay? The light's coming in. Good. Coming in. Good. Good. So I'm just looking for consensual response in both eyes. That's great. Okay. Now I am going to bring the light in and out. Good. And you can just continue looking at it. See if your pupils change, dilate at all. Good. All right, cover one eye. Good. I'm going to cover the other eye. Okay. Now I want you to follow the light with your eyes. Don't move your head, okay? Do not move your head. Great job. Okay. Excellent. All right, and tell me, when is the light at its brightest? Good. Coming back. Good. And other side, when is the light at its brightest? Good. And coming back. Good. All right. Both eyes, when is the light at its brightest? Good. Good. All right. Great. Okay. I'm just going to come in. I have a clean cotton swab here, and I'm going to very gently touch different parts of your face just to make sure your sense of touch has not been impacted. So this is a test of soft touch, okay? Just let me know when you can feel this. Good. Very good. 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 Okay. Good. Excellent. Okay. Now I have this sharp-ish end of a wooden stick. I am going to touch this to, again, different parts of your face. Just let me know when you can hear it. This is a test of sharp touch, okay? Good. 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 Okay, good. Just get in here. Good job. Okay. Very good. All right. And the last one, tuning fork, it will feel very cold to the touch. Good. 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 Good job. Good job. Very good. Okay. Alright, I'm just going to touch around your jaw, okay? Can you clench your jaw for me? Good. Can you open your mouth and don't close it? I'm going to push up on it. Don't close it. Very good. Okay, now I'm going to try to open your mouth. Keep it closed. Good job. I'm going to hold your face. I want you to move to the left and to the right, or rather to your right and then your left, okay? I'm going to hold it. You move against my resistance, okay? Good. Other side. Good. Great job. Okay, I want you to go ahead and big smile with teeth. Very good. Raise your eyebrows. Alright. Crinkle your forehead. Good. Close your eyes tight. I'm going to try to open them. Just keep them nice and closed tight, okay? Great job. And can you puff out your cheeks for me? Good. I'm going to press on your cheeks. Puff them out. Very good. Alright. I'm going to whisper some numbers in your ear. I want you to go ahead and repeat them back to me. 52, 873, 16. Good. 946, 15. Good. 62, 45, 12. Good. 5, 7, 14. Very good. Okay. Now I am going to rustle my fingers in your ear. You let me know which one you hear, okay? Left or right. Good. 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 Very good. Very good. 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 Alright. I am going to strike a tuning fork and bring it to your ear. let me know when you can hear it, okay? Oh, didn't work. Here we go. Okay, other side. Good. Good. There we go. Right. And can you just open your mouth for me? Good. Now go ka, 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 and go, 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 go. Fabulous. All right. And I'm going to put my hands on your shoulders, shrug them for me. Good job. And last thing, go ahead and stick out your tongue and move side to side. Lovely. All right. And do you remember those 3 words that I told you before, the 3 items? Okay, think about it for a second. That's okay. Yeah? Yes, okay. Yeah. Floor, ball, banana. Great job. Okay. So, at this point, I do believe that you probably have a concussion, but I believe it is very mild. So it's important that you get plenty of rest because that helps your brain heal itself. Oh yes, so that's sort of like an old myth. No, it's fine to sleep. You actually need sleep to help yourself heal. If you start to have any vision issues or perception issues, strange smells, anything of that nature, it's very important that you either come back in or go to an emergency room. But right now, everything looks okay. It just seems very mild. You can go ahead and take Tylenol for the headache, and that should start to dissipate. Okay, yeah, so it's already pretty mild. You can take Tylenol to help with that. And over the next day or so, hopefully that goes away completely. If the head trauma is causing you any pain, you can ice that, absolutely. No more than 20 minutes at a time. And Tylenol should help with that as well. Okay? Alright. Yes, I'm so glad you came in though, because you never know. Anything having to do with trauma to the head could be very serious, so always better to be safe than sorry. And I hope you continue to have fun playing soccer, but I hope you are safe in the future and this doesn't happen again, because I know you can't really predict it. Do you have any questions for me? Okay. Well, that's great. I will be sending home an information sheet on concussions with you just to tell you some warning signs to look out for if anything should seem to get worse. But as of right now, everything seems a-okay. Alright? Perfect. Let me go ahead and grab that sheet for you, and then you can go ahead and go home. Very nice to meet you. Okay, I'll go grab that.